Welcome back to Drugs on the Daily, where we educate on one drug a day and bring in an expert to help us out. I'm your host, Lexi. Today we'll be talking about albuterol, which is a bronchodilator, and it's used to prevent exercise-induced asthma, acute bronchospasm, bronchitis, emphysema, bronchiectasis, or other reversible airway constriction. We also have a special guest on with us today who has dealt with using albuterol as she has experienced asthma. So let's welcome Emily.
Hi.
Tell us a little bit about your case and how this all started for you.
Yeah, so I am a 24-year-old female, and I have about a 10-year history of asthma. I was first diagnosed when I had an asthma attack when I was 14 years old, in school, actually, in middle school. I was rushed to the emergency room in an ambulance, and I was immediately administered a fast-acting beta agonist, which is albuterol. I was prescribed albuterol as an inhalant, and I have kept at least one in arm's distance ever since.
So what was your experience like? Does albuterol do anything to you? Like, has it changed you in any way? Or are you still feel like the same person?
It doesn't have a huge effect on my social life, but it has made it hard to exercise and participate in high-functioning activities like sports or anything. It does get difficult, and I run out of breath really easily. So some things like hiking and those kinds of social activities have been hard, but otherwise it's pretty easy to maintain and keep up with.
How did the doctors determine that you had asthma? Like, do they do labs on you, or how does that all work?
Yeah, so they, when I got rushed to the emergency room, they administered albuterol, and then they gave me an inhaler to take home, and I met with my primary, and she listened to my lungs and heard a lot of wheezing, meaning that it was hard for me to breathe, and she could hear that. And she had me use an incentive spirometer, which is used to determine how much you can breathe in. And she determined that my bronchioles weren't working as well as they should be, and I was diagnosed with asthma.
Did you have to change any aspect of your diet for your albuterol use, or is all your diet still the same?
My diet's pretty much the same. I just have to avoid an excessive amount of caffeine because albuterol is sedative, and taking it with too much caffeine can counteract the effects and cause them to not work.
So speaking about food and albuterol, when you do take your albuterol, are you supposed to take it with food, or can you take it whenever?
Yeah, you don't need to take it with food. People with exercise-induced bronchospasms, they should use their inhaler 15 to 30 minutes before exercise, just to make sure those airways are open. And people with normal bronchospasms, they should take about 2 puffs every 4 to 6 hours.
Okay, and I did do some research on this before we had you on the show. So I read that some of the common side effects include restlessness, anxiety, chest pain, a dry nose, throat irritation, nausea, vomiting, and tremors. Have you personally experienced any of those effects with your use of albuterol?
When I first started albuterol, I definitely felt a lot of anxiety and restlessness. I haven't felt a lot of chest pain, but my throat has been irritated due to the inhalant. Otherwise, I haven't had any problems with nausea or vomiting.
Okay, and then I know a lot of drugs, when you mix them with other drugs, they have really bad effects on you. So when you're taking your albuterol, are there any drugs that your doctor told you that aren't compatible? Like, you can't take it at all, and why would that be if there are?
Yeah, so I can't take amoxapine, which is a medication used to treat depression. Amoxapine increases and albuterol decreases sedation, so they would clash and cause my albuterol to not work as effectively. I also can't take sanquinavir because that is a protease inhibitor, and using them together can increase the risk for an irregular heart rhythm and may be serious and potentially life-threatening.
Okay. So while I was doing my research beforehand, I did stumble upon a research article. I know you touched on how people have inhalers for different reasons, such as exercise-induced asthma or just asthma in general. And I stumbled upon a research article that talks about the differences in how some people take it as needed and some people take it like by a schedule, like every 4 hours. And they were just comparing like how the use was effective, and the research article actually found no like changes. Like it doesn't matter if you're taking it on a schedule or as needed. The albuterol still works the same, and the side effects are still the same. And overall, one option isn't better than the other, according to this research article. But with your asthma, is it exercise induced? Like, do you take yours as needed, or you take it on a schedule?
I take mine as needed. It is more so when I feel as though it's getting hard to breathe, then I use it as needed. But my mom has asthma and it's genetic, and she is on a schedule of about every 5 hours because hers is more, hers is a different type of asthma than mine. So no, I'm not on a schedule.
All right. So as we wrap this up, thank you so much for being on.
Yes, thank you for having me.
I just want to let everyone know albuterol works by helping relax the muscles of the airway, which allows more air in and out and with less work. Also, if you are using an inhaler to inhale albuterol, please check with a doctor immediately if you develop a skin rash, hives, itching, trouble breathing or swallowing, or any swelling of your hands, face, or mouth. Thank you so much for listening in, and join us next week on Drugs on the Daily.